What happens here that in 1 hour and a half, we do not have time to make the upper prosthesis of the lady that we just finished and showed you. So we have here the upper prosthesis of the lady we did before that one. We did 2 cases, as you know, with 1 hour interval. So we did the first upper all-on-4, and then 1 hour later we did the second upper all-on-4 that was videoed and transmitted to you. Now it just happens that the lady that we did the upper first, actually is a lady that 6 months before she had bone transplant from the iliac crest, and she just happens to have an all-on-4 inferior, as you can see here, done 6 months ago. And I'm going to place the prosthesis on the inferior, so you can see it's 4 implants, and so we just have to attach and screw retained. This is the immediate prosthesis at the day of surgery. She still carries it, and in fact we have people carrying it for over 4 years now due to economical reasons. So they actually never move into the most sophisticated CM bridge or even wrap around. So now, I believe you do have some questions for me, Patrick.
Yes, we have. Ladies and gentlemen, questions for Lisbon. Your question will go by satellite. So this will an extra thrill. Question. Yes.
My question is that, isn't it possible that we use a denture which we produced before and we can adapt it to the implants very shortly and very quickly, better than taking the impression? And like we use the denture as an impression tray, and we connect the provisional abutment immediately to this denture, and then we see if our jaw relation is okay, and we can proceed directly in the laboratory, and maybe it can take short time. Or if there's any special reason that they are taking the impression and doing the final immediate loading from beginning, like not using a provisional denture. Thank you.
Okay, very good question. In fact, you can do that, and we used to do that. Now, the reason that we did not do it in this case is that because we actually had to do some extractions. And in that sense, there's two reasons not to use the prosthesis of the original removed prosthesis. 2 reasons. First, if the prosthesis is really a bad one, ugly, that's one reason. And the second reason is that if we have a lot of teeth in between, for instance, that if we have to extract, then it's much as well just do a new one. In this case, the upper prosthesis was so ugly that we had to just discard it and do a new one. So that is the reason. But you are quite right. Many times, for the purpose of being more faster, composite. For the purpose of being faster, we actually do use the prosthesis of the gentleman or of the lady, and reline it, if you wish, reline it to make it much faster. Patrick, can you see Murda? Can you see what I see here? In the sense that we have perfect lip support, midline, and now we have a full dentless patient, and the implant on the anterior implant on the canine actually came out on the very cuspid of the canine, which means, and this follows the question that I had before, why don't we have the impression at fixture level? Because this cannot be accepted for the final prosthesis. So what we do here now is we just use some composite, but later on we will do an impression at fixture level, and then the lab technician will choose the abutments, and we'll make sure that these exits come out at the proper place. For the surgery point of view, we don't mind if this comes out there, because then we can just use, as you can see what I'm going to do here, we just use some composite. We just use some composite. We just use some cotton. We place some cotton inside. And then, just to cover the prosthetic screw, and then we use some flow composite, and we fill it up. So it's really very, very straightforward procedure. And now I'm doing dentistry, Patrick.
Beautiful aesthetics, beautiful.
I need Dario here immediately. Dario, immediately come back. So we just use some, we just polymerize. And this is actually very, very straightforward. And of course now I can use a turbine. And it's okay. It's okay. I can use a turbine. I just need another. Okay, there we go. And with a turbine, I can just retouch this. And not going for maximum aesthetics, because this is completely different situation, but we have a lady that is perfectly happy. Now, let me rephrase. This lady was the lady that we did before the other one. We need another half an hour. We need about 2 to 3 hours to make a full prosthesis like this one. So because we knew that satellite time was short, we had this case done 1 hour before, just in case that we couldn't do the other one, which is but the result, of course, is the same. You know, this is what we're talking about. All on 4 upper, and in this case, all on 4 lower. This particular lady is a bone transplant 6 months before. Now, I mentioned this. 6 months before, we did bone transplant from the iliac crest. And this just brings us to the new type or new technologies and new technique that we use for the bone transplant that allows us 6 months later to do immediate function with the over 98% success rate of the implants. So I'm going to ask her now. I'm going to take this out. There is maybe I take this light out now. Can I do this? You got it? No? Is it okay? Do you want me to put lights here? Now, because the light is too strong on our eyes, can we have a good picture? And I'm giving an apple, and she has not bitten an apple for many, many years. Há quanto tempo que não morde uma maçã?
Há muitos anos, parece.
She says that she doesn't bite an apple for many, many years. Now, 6 months ago, we did the all-on-4 inferior and the bone transplant upper. And now, 6 months later, we placed implants in the upper. We have a nice, beautiful fixed prosthesis. And we have a nice, beautiful red apple. Patrick, it does not come from Australia, okay, but still is beautiful. Dê uma mordidela. And here we go. So I think this wraps up what we have to say about All on 4, Patrick.
That is truly fantastic, and everybody here really wants to thank you for sharing this with us, and we want to especially also recognise all of your clinical support staff and your technicians and the other people you have behind the scenes, and most of all we'd like you to give our best wishes to your patient for allowing the patient to share this treatment with us. Thank you very much.
Patrick, if I may finish this in a nice way, I would like to present this flower to this beautiful lady. It's a nice white rose, the color of her beautiful teeth. And we have here for her also to help her swallow the apple, we have a nice champagne that was supplied by Frank Renoir, his vineyard, and also I'll drink to her, of course, and to you, Patrick, also to you, Patrick, and that's to all of you at Yo. Thank you.